is to open your eyes a little bit to a different definition of personalized medicine, a definition that revolves very much around the electronic media, digital health, and where the consumer, ultimately the patient and others, are going to be. One of the problems we as Americans have is I think we think of the healthcare systems around the world very much in the context of the way we discover and develop drugs and diagnostics, the way we deliver healthcare, and the way we pay for healthcare. And as I alluded to and others alluded to, if you look at Scandinavia, where you have a much more integrated healthcare system, you can see dramatically different priorities. You can see dramatically different opportunities and arguably dramatically different places where new technology will make its way to the marketplace. So we're going to park everything that we've talked about so far and jump to the other end of the spectrum. And to do that, Don Jones, who heads the whole life science activity at Qualcomm. Qualcomm is, for those of you who don't know, essentially the chipsets that are in every mobile phone. They are the guts behind a lot of the technology that's enabling us to live in a wireless world. And Andrew, on the other hand, is a company that's gotten a lot of publicity. There's a lot of visibility either at the Wall Street Journal level or at Bloomberg level, but also in the scientific literature about principally his raisin technology, but technology where he can bury an integrated circuit in the front of a pill and do other things, both in-body and on-body kinds of technology. And so these two individuals, I think, can lead us into a rather interesting discussion. So we don't have any pre-planned questions. We're just going to have a relatively flowing dialogue. We hope that you will be engaged in it. And I'm going to start, I think, with Andrew, just to talk for a second a little bit about what Proteus is all about, since this audience, by and large, doesn't know you and doesn't know what Proteus is all about. But more than the definition of what Proteus is all about, where you see healthcare going and how your technology is going to be important in that transformation. And then I'm going to have Don talk a little bit about the wireless world and the consumer world and who's in this world and what are they doing, and more importantly, where the patient is going to fit in and what some of the drivers are that Don sees in the world of wireless health that he lives in. Andrew?
Great, Steve, thanks very much. So I'm going to just sort of run through a framework here for how we think about the world and how we think about our innovation and how it plays within that. Essentially, in simple terms, we make medicines that talk to your cell phone, and that's a pretty personal thing. The problems that we define in healthcare really fall into three categories, three very big thematic issues. The first is access. That's been a big issue in the US conversation, but it's a little bit misdirected in our view because it's not about 30 million people in the richest country in the world. There's roughly 6.8 billion people on the planet, and roughly 85% of them are excluded from our current healthcare system. So that's the access challenge. We do live in a global world, and we have to figure out how we reach everybody on the planet. The second very big challenge relates to value and the way in which we've built our system for delivering population-based medicine. We charge a lot of money for healthcare, and we don't deliver very much value. And I'll use as an example the world's most valuable market for medical devices, which is the cardiac defibrillator. Fully 7 people out of 100 who get one get a therapeutic benefit. That's a $6 billion market. World's most valuable drug, Lipitor, $13 billion drug. 1 in 1,000 have their life saved on that drug. So it's very expensive, doesn't deliver that much, which leads to the last piece, which is sustainability. It's not. And we know that from a number of different dimensions, but it's roughly $2.2 billion to get a new molecular entity approved now. It's on the rise. And if you just look at the PE ratios of the world's leading medical technology and pharmaceutical companies, they're being crushed. And it's because the innovation model that they've relied on and the pipeline valuations that historically have underpinned their market caps are just not valued anymore. So it's a very big set of problems, and they're very global, and they're different from the way that we thought about them in the past. The solution is clearly not to spend money. So we spend $7,700 per head in the US. We have a life expectancy of 79, about $3,600 in Europe, and we have a life expectancy of 81. They spend nearly $100 a head in China, and they have a life expectancy of 75. So money is not going to do it, certainly not on the type of scale that we're doing in the United States. And we have to ask, we think, some much more fundamental questions, particularly about delivery system. So we have a delivery system that's really anchored in the 20th century, and it was designed to treat lethal acute diseases that killed the young and adults in their prime. Many of those diseases have been conquered. And the issues that we face in healthcare today are very, very largely about chronic disease. It's about diabetes, it's about depression, it's about dementia, it's about other things like that. These are not well suited to being dealt with in a doctor and hospital high-cost intensive system, and just it's not going to fly. So we need a new delivery system that's anchored in 21st century infrastructure and is specifically designed to deliver much more value and release much more of the therapeutic potential from the products that we've already discovered. What we need to do, in our view, is deliver medicine where people live, in a way they understand, for value that they can see and measure, at a price they can afford to pay, personalized to their individual needs. It's a pretty simple idea, but it's powerful, we think. So let's transition to the new delivery system and what that looks like. Well, we'll talk about the internet and the mobile phone. The global internet is more available than water or electricity. It's the most important utility on the planet. There are more cell phones on the planet than there are toasters, about 5 billion. So it will be the backbone of the 21st century healthcare delivery system, in our view. There's roughly 1 billion of the 5 caring for someone who's sick. That's the largest group of healthcare workers in the world. They have no tools, no rewards, and no recognition. But these are the people we actually rely on to personalize care. So the question that we ask as a company is, how do you reach those people? How do you embrace them, empower them, and enable them to do the job that they're already doing? And that's where our technology comes in. For us, the drug is the plug. It's the way you plug into the network and you reach these people. And the goal of our products is to deliver in one seamless package medicine combined with information, education, and motivation that these patients and their families can use to personalize their therapy and cause it to release value. And we can do that with a backbone that enables us to integrate not only behavioral information, but genetic information and environmental information to create a body of what we're going to call meta-markers that will enable a lot of personalization with respect to evidence-based pathways, because as we know who you are, where you are, what you do, how you live, how you take your medicine, we can start to fairly dramatically personalize the way in which you get treated for very many common diseases. And the really interesting thing about this as a platform is that we will do it at a price that is way below the price of a branded pharmaceutical. And that, we think, is incredibly powerful and has the potential for great impact, not just in this country, but frankly all over the globe.
Simple. So you want to talk just for 1 second before we hand it off to Donna about specifically what Proteus does?
So in very specific terms, we have engineered essentially a food-based computing platform. We make something that looks and feels pretty much like a grain of sand. It is sand, it's silicon. It has some common vitamins associated with it, a bit of copper, a bit of magnesium in amounts that are well below your IDA. If you swallow one of these devices, we basically co-manufacture them with a medicine, then the medicine turns on and sends a signal through your body. It's not a radio signal, it's completely private. We detect it using something that we call a personal health companion, which is a little band-aid that you wear. That device is also tracking your physiology, so we track your heart rate, your respiration, your body angle, your sleep, your temperature, your activity, and we're able to create a data string that enables us to see how well you are and what medicine you're taking. And we put that then into what we call a user experience environment where we build applications for both consumers, families, physicians, health systems that basically aggregate data and turn it into actionable meaning that's tailored for whoever the audience is. So it's different for a patient than it is for a clinician, for example. But the idea here is to reduce medicine to essentially a series of lights on a dashboard, a bit like the way you drive your car. So if you've got a problem, you get an orange light.
So think integrated circuit in the front of a pill, swallow a pill, that becomes your in-body sensor. Out-body sensor is your communication device. You have a smart Band-Aid that communicates with the world.
That's it.
Simple in theory. Don, you want to talk about your world for a minute and how Qualcomm sees the world of wireless health?
We're the largest manufacturer of chips for cell phones. We thought we had a really good business model until Andrew showed us that there's a better model if you get people to eat the chips. So we're cheering them on the chip side. I was at a dinner meeting a couple of years back with Sir Tim Berners-Lee, who's credited with inventing the World Wide Web, and going around the room with a bunch of university chancellors and medical school presidents, he asked, "What are you doing on the web?" And I had to come up with something entertaining and relevant to my work. And so the answer was, as I put bodies and organs on the net. I give them IP addresses and make them nodes on the net. And that's really what my group does at Qualcomm. We take advantage of that pervasive utility in the form of the cellular network, which is vastly more available throughout the world than running water and electricity. There's more people that have cell phones than there are that brush their teeth in the world by well over 1 billion, just to give you another kind of reference point. And we work with life science companies, both in the pharma arena and the med device arena, to wirelessly enable their devices so they can create scalable global solutions that add connectivity. And that connectivity is then used for therapy management, for titration, for diagnostics, for remote monitoring purposes. The list goes on and on and on. But I wanted to show you, just to give you an example of, what do body-worn sensors look like? So Jamie, can you show what body-worn sensors look like? So Jamie's wearing body-worn sensors right now. She has ECG, heart rate, respiratory rate, temperature, and motion and posture on the screen. Now you're not going to be able to see this all, but she'll be downstairs when you're having drinks and you can see it. But I wanted you to see the body-worn sensors.
Can it tell when she's had a drink?
You'll be able to see what happens to her heart rate. Just see how many you can feed into her and see what happens. But I just wanted to make the point that body-worn sensors don't have to be very big at all. This is a continuous glucose sensor from Dexcom. It's got a radio in the middle. The patch is disposable. The radio is replaceable. This lasts for 7 days and then is replaced with another patch. And this transmits to a gateway device using the very low power radio here in the continuous sensor. One of many sensors. We currently are working with somewhere north of about 50 different categories of physiological sensors, whether they be chemical or electrical kind of in basis. And to give you some sense as to how complex they are, this is one from Corventis. It's got 8 sensors in a Band-Aid for a cardiac product. Does ECG and heart rate, respiratory rate, does actually fluid levels. It's targeting the congestive heart failure patient. Multiple sensors on the back pad, very easy, worn on the chest. So you can imagine how, for example, this hasn't been done yet, but you could imagine quite easily, for example, how this kind of sensor might be married with Andy's kind of sensors, and you get into a system where the patch is advising regarding titration, and the pill, which might be Lasix, as an example, can be confirmed that it's being taken as per the actual physiological response of the patient. And I've got one more thing to show you. And some people say, well, how big do things have to be, or how small can they be before they can be hung on the net, on the cellular net? And this is everything you need for a cell phone but a battery, the size of an American nickel. So if that can fit in your widget can be on the cellular network in anywhere in the world. That's right now the current state of the art in terms of how small the guts of a cell phone can look. And so what this is empowering is a wide degree of new business models for the reasons I said, the titration, the therapy management, the diagnostics, the monitoring functions. But it's also empowering another business model, and that's something we call personal supply chain management. And what we mean by that, and this is where the pharmaceutical companies get really interested, is where you have a disposable, a consumable, a medication, something you'd like to sell more of, you can actually put the reorder button on the product, whether that be the pill bottle, whether that be some other kind of dispenser. We're currently working with everything from inhalers to pill bottles to a variety of diagnostic devices where the actual pharmaceutical product, the consumable portion of it, actually has, number one, a direct relationship between the consumer and the manufacturer, and the reordering function, the I need some more button, the Amazon one-touch, get me some more button is actually right on the product.
So if you think about Walmart for a minute, Walmart succeeded because as soon as that thing went through the scanner, as you went out, the order was literally back to the factory to make some more, and the truck was on its way delivering replacement. So as you think about pharmaceuticals, which by and large are treating chronic conditions where we have recurrent needs, this kind of automatic reorder based on what's going on in you. The compliance side, we all know that the compliance side of medicine is very poor, below 50%. The compliance side can go way, way up, which provides much better data. But it also provides this incredible connectability of the entire logistical kind of value chain.